live session. We couldn't make a live injection, but we will try to show you some videos regarding the Botox injection, and we will give you the feeling that it's a live injection. Actually, I will present some videos that I didn't do any edit, so it's true videos. And of course, Richard, I'm pretty sure that he will criticize because he's the master of the video presentation, but it's the videos taken with the iPhone by the nurse, so let's see. So just few words about some tips. I take the presentation of our fellow and now future consultant, Dr. Ahmed Suleiman, and he made a very nice presentation. This our workshop regarding the Botox injection is coming now in the room, and we will give some tips. So very important, any cosmetic, I just finished the blepharoplasty session, and I would stress that the most common complication for the cosmesis patients is patient expectation. So even with Botox, although it looks like a very easy and nice procedure to do, make sure you explain well what actually and in reality the patient can gain. Otherwise, that's the most common complication. I know that is pretty obvious, but spend your time to make now a consultation with patients. Remove the makeup, for example. Look exactly also the anatomy. Sometimes use the mirror, the hand holding mirror, because the patients don't realize, for example, that he already has a minimal ptosis. That's what I just said during the BLEF course. They don't realize that they have a minimal ptosis, and after the treatment, they say, you caused the ptosis. I didn't have. And so take picture and look at the anatomy, look the levator function, look the position of the brow, and spend some time in dedicating to all those things. When you prepare the patient, you can, of course, this is, I often use, say that patients that undergo to cosmetic procedure, they are, of course, more tolerant about pain and any other side effect of the outcome because they want to improve their appearance. Although this, I would suggest anyway to use, even for the Botox injection, some kind of anesthesiologic tool like the ice packing or the local cream anesthetic application like you can see in this case. You can apply topically when we have done the location on the sites that you want inject, or sometimes I spread all over the forehead just to make sure that it works. And if you use topical application of the cream, let's do it 20 minutes at least before the injection. Otherwise, it doesn't work. For the injection technique, I'm not reading because it's, I would give you only some tips. So make sure that when you inject the glabellar area, you pinch the muscle, but when you inject the forehead or when you inject the crown wrinkles here, you inject very superficial. Don't go deep. Don't try to go on bone on the superficial, because otherwise you don't have the effect that you can gain some side effect. Another important thing is, so as you can see here, in the glabellar area, you have to pinch the area and inject, avoid the neurovascular structure. One of the things that I would like to discuss about, I will show you, I will discuss you during while I show the video, is that there are many different, if you attend 10 courses about the Botox injection, believe me, you will see 10 different techniques. Some people inject only one line for the forehead, some people two, some people goes to the attachment of the hair, some people make multiple injections, some people make distance at least of 2 centimeters, and some people mark the injection in between the wrinkles, and some people make the injection very close to the wrinkles. I don't know which one works better, but I think that it's on your own experience. Those are the anatomy of the face that we are interested in. So remember all the vascular structure in the face when you inject. Try to avoid to. I remember that one of the tip that one of the mentor gave to me is then the smaller is the needle that are using, the higher are the chance that you can go directly in a vessel. So remember that for injection, we are using for the Botox injection, we are using a small needle. So that's why, and if you inject botulinum toxin in the blood, it's pretty little, it's quite big issue. So remember exactly the structure and everything when you do injection. And this is the muscle, the procerus, the frontalis from the forehead, and we have the orbicularis that, as you know, it's divided in 3. It's not showing very well. It's dividing in 3 parts, and remember that we have pretarsal, preseptal, and preorbital part of the orbicularis muscle. Okay. So as you can see here, we can have, this is the site of injection for the glabellar area, and some site of injection. This technique, I will show you 2 videos. One, where you will see the line of the injection for the forehead, only 1 line, and with 5 sites of injection, and you will see another one that we have 2 lines of injection. Okay, and one of the guidelines to make the marking here for these wrinkles is to stay away from the orbital rim at least 1 centimeter. While are you doing the injection, how do you evaluate 1 centimeter? I would suggest roughly just put a finger in between the orbital rim and the site of injection. And you are pretty much sure that you are away from the injection in the risk of injection in the orbit. Because you know that one of the complications might be that the diffusion of the Botox in the orbit can lead to diplopia afterwards. It's something that nobody wants. Okay. And you can also inject some Botox around the lips for the wrinkles. Yes, this is a technique. Now there is a little bit of a swift of the injection around the lip, because there are some concern to inject around the lips. The Botox, you can use some very low density filler that can at the same time work as Botox and as can work for the wrinkles and to give some volume. So I want to show you, this is the edited video. Now I want to show you the crude video. Can we go for the next? We will see the 5 minutes. You want to see the edited video or the 5 minutes video? 5? Okay. Can we go for the next? Okay, so you will see the assessment. So ask the patient, you see, to rise the forehead, to smile, and because it's the treatment, that's what I'm trying to say. If you think that you go to the book, see the site of injection, and you do the same for every patient, doesn't work. The treatment must be customized. And so that's, you have to spend some time in figuring out exactly where are the wrinkles. And you have, of course, be used to find the exact points that you want inject. So we start the injection here after the assessment. Notice, please, that we hit the tip of the needles is hitting far from the orbit. It's never is pointing to the orbit, but it's pointing laterally. And there is not, of course, you can start wherever you want. You can start from the crown wrinkles, you can start from the forehead, you can start from the glabella. And again, see that we are very, very superficial. And you can go not exactly, you can go even a little bit lateral in between the marking that you have done. But the most important thing is that here, look at the position of the syringe. Very superficial. So, and it's blowing a little bit subdermal. And this is actually the more likely the real time. One of the most important things that we will see also in the other video that is even shorter is that although we have applied some anesthetic, although we have applied some ice packing, this injection is a little bit uncomfortable. Some patients feel pain. So if the patient starts to feel nervous to move, it will be difficult. So you have not to be, because you have not rushed, but you have to make the injection. Once you have done the marking and you start to inject, is much better that you do in a short time, instead to do injection, then wait, you make the patient. It's like when we do surgery in local anesthesia. Everybody knows, we are all surgeons, everybody knows that when you do surgery on the local anesthesia, you should, you cannot waste your time, and it's important to optimize the timing of the surgery. And it is anyway a surgical, it's a minimal invasive, but it's like kind of surgical procedure. So you have to be pretty fast. And you can see the injection in the glabellar area. Any comments from the Habib? Richard, any comments during the video? No, Habib, if you want.
I would direct the needle upwards.
Okay, yes, I would see in the second video, yeah.
Yeah, and also laterally for the crow feet, I go a little bit more lateral.
Ah, okay.
Because the orbicularis expands.
Yes.
Expands so widely. So it's, I'm afraid, so I go a bit further. Oh. Yeah, but perfect, very nice.
Yeah, I think that we didn't talk about I'm glad that now the pointer is showing a little bit, about the dose. When we go in the glabellar area, you can go for 5 units, okay? So this is another thing that you have to learn. Do you think it's easy to inject and evaluate the amount that you are injecting? That is something that you have to learn, because remember that the lesion is 5 units for 0.1. So it's when we inject 2.5 units, it's just half of this. Okay, so and it's just a small injection. We can give 5 here in this area, but here we are giving 2.5. And another thing is when the patient never had before Botox, you can give even less. It's much better to start with less dose and then you can increase the dose afterwards. One of the things that I would like to discuss here with you is when you repeat, you can add a little bit after 2 weeks. You can add some area, some Botox after 2 weeks, no later, not earlier. You can add a little bit of Botox to adjust if there are some wrinkles left. And that's it. This was live. The last video is very short, and it's another technique that we have used. Can we see the other? No, the other one, the third one. Yes, okay. This is, believe me, from the beginning to the end. No edit, no tricks. So you can count, it's 3 minutes and something. And yes, see that we inject exactly.
So this is into the procerus muscle, isn't it?
Exactly.
Procerus muscle.
5 units.
Yeah, 5 units, yeah. So we have the strongest
yes. Yes, there was a little bit, it's a live video, so
excellent.
the nurses was holding
that's
my
what people
phone,
want
so
yeah.
it's just to give you exactly the feeling of the procedure. The patient is sitting and you can see so in a high magnification. Please note that in this case, see, we went a little bit close of the central wrinkle. And another thing is to avoid the ptosis, you have to be away from the brow, at least more than 1 finger, especially in the temporal side. Okay? And as you can see, we have one first line, 2.5 units, and the second line. You can go also, especially if the patient already had some injection, you can go even up to here, and it increases the final result. Then there is another trick that you can use. If you want to treat some wrinkles a little bit close to the brow, you can use the super diluted Botox. You make like one of the cc, 1 point the C that you have in the syringe, and you add 9 parts of BSS, so you have super diluted Botox concentration, and you can go a little bit close to the eyebrow. So see that I'm pointing very far from the orbit, and it's very, very effective. It's very, very effective if you go there. Don't need to go. Another tip is the pressure. I just dry after the injection. I never press on the site of the injection because I want to prevent any spreading of the Botox. There is no need to spread the Botox injection. And there is a little bit of bleeding. Another suggestion that I would say that you know which one sometimes bother the patient when they have to go out from the office is not the bleeding, is the marking. It's very difficult sometimes, and you cannot make pressure with the alcohol pad, because otherwise you will gain some spreading of, you will lead to some spreading of the Botox. So you have to remove gently, and the patients sometimes are not happy. So you can say to the patient, for example, to bring some hat or covering something to cover, because they want. Many people they don't want, have the appearance that they had the cosmetic surgery. So that is another of the suggestions that I would like to share with you. Okay, and that was I think was just a little bit more than 3 minutes. That's it. That was the crude one, the original one video of the injection.
Thank
Okay?
you. That was excellent. Yeah, excellent. Thank you. Thank you.